thank you to all of the Queenslanders coming out and getting tested and also vaccinated. We're seeing an uptake not just at our Queensland health clinics but also at GPs, and now that we have more pharmacies opening up, we are seeing more opportunity for people to come forward and get vaccinated. So if you're not sure what's available in your local community, please jump online. You can check through the eligibility checker and also putting in your postcode and find out not just where your GPs are but also where your community pharmacies are and where the Queensland health clinics are across the state. So we want to see more people coming out and getting vaccinated. We're now at 23.07% have had their second dose across Queensland of eligible Queenslanders. We're seeing that number going up every day now, which is fantastic. I do want to just go through again, as Dr. Young has, what restrictions are now in place for the ACT and also those 7 local government authorities across the border zone. So when it comes to the ACT, there are 3 groups that we need to talk to. First being anyone who is already in Queensland, who arrived before 5 p.m. yesterday, who has been in the ACT on or after the 9th of August. For those people, you must home quarantine immediately and remain in quarantine for 14 days since arriving in Queensland or since the 9th of August, whichever is shorter. The next group is anyone who arrived from 5 p.m. yesterday. You are all required to quarantine at home for 14 days. And the next group were those that arrive from 1 a.m. tomorrow, Saturday, the 14th of August. You will be required, if you are eligible to come into Queensland, so you have a border declaration that allows you to come, so you're a Queensland resident or you have an exemption to come into Queensland, you will have to go into hotel quarantine. So those are the 3 categories. In relation to the 7 local government authorities on the border, I just want to go through the essential workers. I know there's been a lot of discussion over the last 24 hours who can and can't come in and out of those 7 LGAs. So essential workers are medical practitioners, an emergency health services or emergency services worker, national defence, state security or police worker, a freight or logistics operator, an emergency infrastructure worker, emergency volunteer, disaster management worker, a critical infrastructure worker, a tradesperson or construction worker for essential or emergency construction or repairs only. Essential workers do not include teachers, anyone who can perform their work remotely at home, childcare workers, hospitality workers, sale representatives and commercial construction workers on non-critical projects. Can I just emphasise, I know there's been a bit of discussion about teachers and childcare workers because in the past they haven't necessarily been excluded from these movements. The reason why we have to exclude them in relation to these 7 LGAs, and it's only the 7 LGAs that New South Wales have put into lockdown, is because we cannot risk these teachers and childcare workers coming into Queensland, going into our schools and our daycare centres and risking spreading the virus. We've seen what this Indooroopilly cluster can do, and we've seen what having students infected can do. We are up to 137 people infected from our Indooroopilly cluster. So we can't take the risk of the virus getting into any of our schools. So we ask people to comply with those restrictions, and of course they're obliged by law to comply with the New South Wales lockdown restrictions anyway. Any other areas outside of those 7 LGAs that are in the border zone, the normal arrangements apply as far as travel and the border declarations. Last shout out, of course, is to our household home quarantine people who are still having to remain in quarantine. Thank you for the great work you're doing. I also want to give a shout out. I've been meeting lots of people, including at the convention centre the other day, who are supporting friends and family who are in home quarantine. And thank you for reaching out to them, for offering to walk their dogs, getting groceries for them. All the help you're doing means that these people can stay at home. So we're really grateful for that. And the last thing, I've been asked to give a bit of a call out. Our disposable masks, we're seeing a fair bit of littering of those disposable masks. So Can we ask everyone to be responsible and dispose of your disposable mask in rubbish bins so they're not littered all over our streets and potentially going into our waterways as well? Thank you.